Hi guys, how are you doing? It's Elaine Bintz, fitness coach and nutritionist. It's May of 2024 and I want you guys to keep working on your skills of regulating eating habits or eating behaviors. So if you check out my video earlier in May, I did a video describing actions and practices you can do in order to develop the skills of regulating eating habits or eating behaviors. And rather than rehashing and going through the same information again, I decided I was going to do something physical. A lot of clients have been asking me to do more movement videos. So as a fitness coach, I do this every day with clients. But of course, I haven't had videos on certain things. So today I am going to take some time to teach you guys how to use a foam roller. So I know in practice, in the past 25 years since I've been practicing in the world of fitness and wellness, I have taught these classes at corporations, I've taught them in gyms, I've taught them at schools, I've taught one-on-one with clients, I've taught in small groups like at Fleet Feet in Cherville, but it had dawned on me that I didn't make a YouTube video with foam rolling. So foam rolling is something I encourage clients to do all the time. So of course, if you are new to foam rolling, I want to give just a basics of what foam rolling is, and then of course how to implement. Okay, so there are different sizes. So if you look at this blue one, this is a shorter. It is going to be less inches than one of the full ones. So if you look at me, I'm 5'2". So this foam roller, it only goes to about my knee, so it's a much smaller foam roller. This is highly effective, especially if you need something just quick in your office, or if you want to keep it in your trunk. Say you do a lot of outdoor activities, biking, walking, running, especially now in the Midwest here in Northwest Indiana. We've had a lot of 80-degree days. So having this tool handy, say in your trunk, if you are traveling and doing activities that are outside of your home or outside of a gym, it's a great tool to have. The one that I usually use this 36-inch foam roller, which if you can see for my height, for 5'2", it ends up being at about my hip height. So in regards to purchasing one of these, Amazon, you can go to, Target, Meijer, Walmart, a lot of places have these. They're so handy. You don't have to go to a sporting goods store. So I'm just going to take you through some foam rolling exercises, and then we'll recap again with our May challenge, regulating eating behaviors. And then in the month of June, of course, we will do a new challenge. So foam rolling, so what is it? So foam, this is the company I bought. Spree, S-P-R-I is just the brand of the foam. This is not a plug for Spree. It just happens to be the foam roller I'm using. I have at least half a dozen at my place. So the foam texture, the density of this is very durable. So I have had clients that are over 500 pounds use a foam roller. I've had clients that were children use foam roller. There's no specific weight. I don't know, a lot of questions I get when people will ask about the actual foam roller is the weight capacity. So I don't know why that is a question, but that is a question. So there really isn't like as far as I know, I don't sell foam rollers, but I think there's no weight limit. But what it works is, say for example, like regular stretching. So I stretch every day. So say for example, my back is tight, and I'm kneeling because I'm going to do a lot on the floor here. So say my back is tight, and traditional stretches, things that I would think to do, even like in a yoga class or forward fold, things like this. So these are all very good stretches and excellent things to do on a daily basis. But foam rolling takes your stretching to a whole new level. So I'm going to start with the back. They say over 80% of Americans are going to have low back pain at some time, so let's start with the lower back. So the pressure that you put against a muscle, so this is like one of the laws of physics, is when there is a strain or some sort of a tightness or compression that you have in your body, there is an equal and opposite reaction that happens when you apply pressure to that point, which is why if you go receive a massage or you do trigger point therapy or you use a Theragun, or a tennis ball or a lacrosse ball, if you apply pressure to a point on your body that is tight, once you release the pressure, oftentimes the area on your body feels better because you release that pressure point, the equal and opposite reaction. So the same thing happens with myofascial release or foam rolling. Myo is muscle, fascia is the tissue around it. It's any connective tissue, like your fat is considered fascia, your skin, your ligaments, your tendons, all of that surrounding, like even bone is considered fascia outside of the muscle. So let's start with the lower back. Okay, so low back, so you want to find a space where you have, like for example, if your foam roller is 3 feet long, you're going to want to have enough space. So here in my living room, I have enough space for 3 feet. And then you're going to want to be able to be in comfortable clothes. Like I am in exercise clothes. You could do this in your pajamas. Some people have asked about doing them in jeans. So I don't know that I would foam roll in jeans. Because of the actual material, there's going to be a lot of space in between like a jean texture and your actual skin. And it is awesome if you can get skin to skin contact. But you know, exercise clothes are usually thin and very movable. So that would be an ideal attire to wear if you're foam rolling. So starting at the low back, so you want to have the foam roller right at your low back, and then you're just gently leaning back. Now I foam roll frequently so I can handle a lot of pressure, but if you're brand new to this, when you're initially applying pressure on your back, you might want to have a kickstand. Like my arm here would be a support for me if you can't handle a lot of pressure on your back, which is totally normal. So what happens when you're doing this, you want to relax, you want to breathe, and if you can handle it, allow your body to drape over your foam roller. So when you find a point of tightness, this is the same theory that applies with massage therapy, is if you find a point on your body that needs more attention, spend more time there. And then, as the name implies, foam rolling, you can literally roll, so going up toward rhomboids, spinalis, lats, traps, all the way up to your neck area, and you find an area that's tight. Like for me right now, I did back exercises the other day, so I can feel, I did a lot of rows, so I can feel a lot between my shoulder blades and my lats. So I might spend some time here, relax my head, breathe, take your time, and then find the areas that need work. So say for example, you have a job where you have a lot of overhead work. So I've had clients that are crane operators, or they work at a job where they have to do a lot over their head. Their lats might need stretching. So if you go on an angle and you find the muscle that's right under your shoulder blade, and you just sit there for a couple minutes and breathe and allow your body to just kind of drip into the foam roller so that you are relaxing and breathing. And then again, you can use your legs to help you roll up and find any points of tightness. So I'm going through this video at a quicker rate, so you can hold each of these positions for like 30 seconds or a minute, or however much time you need. I'm just going through the motions today more quickly in the essence of time. So if you do something on one side of the body, chances are most movements in life are bilateral. So what that means is if you do something on the right side, unless you really are like right dominant, using, like sitting at a desk, using a mouse every day, but most movements in life are bilateral, meaning you use both sides of your body. So if you find that the right side of your lats are really tight, you probably need to stretch the left side as well. So then switch over to the other side. You can move your foam roller or your body. I'm facing the camera. And then same thing, is find that point under your shoulder blade, allow your feet to just come straight. Just make sure you have enough room wherever you are that you're relaxed. Oftentimes people will try to do these things in their office, which depending on the square footage of your office, it may or may not work. But the living room tends to be a great space, or if you have a rec room at home, that's a great room, or if you do have a workout room. And then again, roll up, find the point that's tight, and you can support the weight of your head. Some people will say their neck gets tight, so you can support your head with your hand to allow for more deeper relaxation. So those are just two back foam rolling stretches or exercises, I use the term intermittently. I know that, or interchangeably, I know people will ask me that, is foam rolling considered exercise or is it stretching? Both. So anytime you use your muscle, it's going to be exercise. But I oftentimes will do this either to warm a client up, especially if they're post some sort of a surgery or rehab or physical therapy. So we'll open up the tissue a little bit, allow the tissue to warm up. And then if they haven't already had an active warm-up like a walk or some, some movement, calisthenics, then go into the workout. So a couple more areas. I'm just going to show you some of the most tight areas I see on clients. So after low back, upper back, lats, I would move into the glutes. So the glutes are your butt muscles. So what I tend to find, and this is documented with research, is if you have very tight back muscles, oftentimes your glutes are tight or they are not strong. So an area I would work on clients, and I'm going to change my position so that you can see me a little better, is using the foam roller on your glutes. So your body is on an angle and you're leaning into the foam roller. You can kickstand behind you for support. And then as you roll up and down, the glutes are really small. I mean, if you look at the palm of your hand, your glutes are probably bigger than the palm of your hand. You're not moving a whole lot, maybe 4 or 5 inches, and then changing your position. So a figure 4, making this position with your legs, is crossing the leg that is on the roller, and if you can handle it, this is a deeper stretch. So the figure 4 movement will target the lateral rotators. So if you're familiar with piriformis syndrome or sciatica, so oftentimes as a massage therapist, people will come in with sciatic pain. So there is a muscle that lays, that is part of your lateral rotators, or these 6 muscles that go across from here over here. So there's a crossing point. That there are these muscles that wrap around, and if they're tight, there is this nerve called the sciatic nerve that runs down, and it can radiate, the pain can radiate down your legs. So what you do is you apply pressure. So if you can handle it, you have the kickstand behind you, the figure 4 with your leg, and you apply pressure. So just let your body sink into your foam roller. And there again is the theory of the equal and opposite reaction. So if the muscle is really tight, mine, it just doesn't happen to be right now. My piriformis or my lateral rotators, my glutes are not tight. But you will feel a slight discomfort and then hopefully a release. So if you do suffer from sciatica or really tight low back or tight glutes, and I'm going to do this on the other side to show you as well. So try to do, if you do one side, try to do the other side. So your body is on an angle and then you're resting your glutes on the foam roller. And initially I would roll to warm up your glutes and do this, like I said, maybe a minute or 2. I'm just going more quickly through the video today. And then figure 4, so have your leg that is touching the foam roller, create that 4 number, and then the other leg is supporting your body weight. And then this will help you to release tight glutes. And hopefully if you do experience sciatica, which if you do, I'm so sorry. I've heard that it's so painful. Even in pregnancy, I was very lucky, knock on wood, to not have experienced that pain. But that is really common. And then the last one I'm going to do, there's a lot more, well, I'll do 2 more. So there's a lot more you can do, but this is becoming a longer video than I planned, is foam rolling the quads. So one of the keys is when you foam roll at the quad, you don't want direct pressure on the patella. So you don't want direct pressure right on the bone, okay? So you're going to want to focus on the meaty part, the muscle part of your leg. And then you're going to be prone, you're going to be face down, and your legs are both going to be side to side so that you are resting on your foam roller. And you can roll, again, find a point, so roll back and forward. So make sure, again, you have enough room so you're not kicking into things. And then if you find a point that's really tight, hang out there, breathe, and allow your body to just enjoy the release and the foam roll stretch that you're getting in your muscles. So depending on the job, even if you do sit and have a sedentary job, your quads can get tight from not moving. And then the last one I'm going to show you, this is super common. So if you've ever had IT band issues, a lot of runners, I'm a former long distance runner, there's this band that runs on the outside of your hip down across your knee. It's the iliotibial band. So the point is it's connective tissue that helps to connect the front and the back parts of the leg, of the thigh compartment. So what it does is it will support you, and sometimes if you're not stretching, or even if you're sitting all day, this particular area of tissue will get really, really tight. So now this is one of those moves where a lot of people will say, oh my gosh, I can't handle this. This hurts, you know, this does not feel good. I understand. When I first started foam rolling, I would say probably back in college, it didn't really feel good. But it is highly effective, and you put only as much pressure as you can handle. So your hips are stacked. What that means is they're square. They're one on top of the other. You're not rotating in forward, and you're not rotating back. So your legs are side by side, and if you can handle it, allow the weight to go onto your shoulder and then roll up so that you end up rolling down the leg. So you're rolling this way to a point on your IT band where you feel like you need that pressure. And then you would do the exact same thing on the other side. So iliotibial band syndrome is a real thing. So I've had plenty of clients that end up going to physical therapy, or you know, they've had some sort of an injury that they're treating, and maybe they had an injury for a really long time, but nobody really told them about it. So definitely this stretch, especially if you're a runner, even a long distance, or a walker or a cyclist, anything that's using repetitive motion at the legs, I would definitely encourage you to do foam rolling of your IT band. Okay, so these are just a couple of things. There is more that you can do for your upper body. But I probably will do another video because a lot of people have asked me to do a foam rolling video. So if you're new to this, you can find these. I want to say they're only like 20 bucks, maybe 25 bucks on Amazon. Or, you know, Father's Day is coming around next month. You can get one for the family, one or two. They're really not that expensive. But I've taught our son how to do this. Our 6-year-old is interested. So foam rolling really is excellent for relaxation. It doesn't have to be after a workout. You can foam roll at any time, before you go to work in the morning, before you go to work at night, whenever you work. As a relaxation activity in the evening, you know, you can keep one in your living room. And, you know, 5 minutes maybe while you're watching TV, just get on the floor and foam roll. So I hope this video was helpful. I want you guys to keep focusing on your May challenge, which is to continue regulating your eating behaviors. Now, if you want more in-depth information, I would check out the earlier video in May, because those actions and practices, they're gonna be, I didn't want to repeat in the second May video. So again, it's Elaine Bintz, fitness coach, nutritionist. Please practice these movements, and of course, always, if you have pain at any time, stop immediately. Do not continue. Do not push through pain. As a fitness coach, I do not follow the mentality of no pain, no gain. I think pain tells your body something is wrong, and you need to stop. So please just do what is in your comfort level. I hope this video on foam rolling was helpful, and have a great day. Thanks, guys. Bye.